to be awesome. This will help us get further away.
Hook it on your collar, please.
Okay, good. I'm going to hook this on my collar.
Hey, we're trying. Just help me a minute and entertain me with this.
All right, you'll get some entertainment here then.
We're already entertained.
All right.
Use that word.
Very good, very good. So, where was I? All right. So when these Hoyers first came to the hospital, when we first got them, I was a physical therapist up on the floor. I happened to buy a room where they were doing an in-service for it, and I went in and got an in-service on the Hoyer lift. So I'm going to show you what we learned in the in-service, and it's going to be kind of quick because there's just kind of a few high points, and then if you have questions, we can go over. So my understanding is that if you guys bring people down here and they're on carts, you do a lateral transfer to get them over onto your tables, and then a lateral transfer back to the cart. But sometimes they'll show up on a motorized cart or in a wheelchair, and then you need the Hoyer. If they show up walking, you don't need the Hoyer. That was a joke. Okay. Courtesy laugh. So we're gonna move this way because I need to get stuff.
All right.
We're moving. All right. All right. So that's probably my best side. Right here. Might have a full head of hair from back there. So we'll use the the wheelchair. Who's gonna be our guinea pig? Thank you, sir, for volunteering. All right. So someone
I am
shows
dead weight.
up there in a wheelchair.
You guys are gonna work for this.
All right. So the slings. The slings look like this. Most of them are not so big. This is a really big sling. You'll notice as you're looking for these slings in the hospital, most of the slings are this big. This won't fit most all of our patients here because it's too big. You have to read the tag on the back to tell the size that you need for your patient. You clearly see that you can't read anything on this tag. So you're going to have to eyeball it, but most of the ones we have are this big, but really for most of our patients you're going to need a medium, maybe a large. Okay? And the reason, which you'll see here in a minute, is because there's no support under the butt of the patient. So if there's someone who has tone, muscle tone, like anyone who can stand up and walk, that's fine, because they can extend their hip and stay in the sling. But if it's someone who does not have muscle tone, they'll fold in half and they'll slide right through the hole in it. So that's why you want to make sure that you have a size that's generally appropriate. So these slings, the reason they're shaped like this is so that you can get them on and off of patients while they're in bed or in chairs without having to stand them up first. All you have to do is be able to lean them forward, which is also part of the reason this headpiece here is a little bit rigid. So this one has a couple of stays in it. Some of the other ones that we have, it's like a full piece of slightly bendable plastic, but it's so that you can push it down behind the patient. So this would be our patient here. He's going to be a pretty easy guy to do this with, I would hope. So
Make it hard.
let's not do that. So we have him lean forward, and then we're going to use this piece, and we're going to push it all the way down to his hips, and then this part you can pull back up again. But you're going to use this to push the whole sling down to his hips, and then he can lean back like so. All right. These pieces are for the legs. They will have a tendency to get twisted, so I think some of the other ones, I'm not positive, but I think they might have two tones, so you can make sure that you're not twisting the leg, so that the part that's facing him is always facing him and the leg piece isn't twisted. Okay, so these leg pieces then, if they can lift their legs, you would have him lift that leg up and you come underneath. If he can't, then you would just lift his leg up for him and pull this under. Now, when he's sitting on it, it should be underneath his thighs. Not down here under his knees, but under his thighs. And then the leg pieces cross, right? They cross and, doesn't matter which one, but they're supposed to cross and go like so. Righto? Okay, all of them, then you'll notice, have these colorful straps. Well, the straps are black, but then they've got the hook pieces. Where's our camera guy? So, white, orange, blue, and then black for this one. And then they should all correspond. Those are like for the sizing. So when you're hooking one side, if you're hooking it on blue, then you just can know that you're going to use blue on all of them, because it's not just the leg ones. The same colors are on the ones for the shoulders, so that you can know this is the size that we use for that patient. With these big ones, if you're using these, you're probably always going to be on the white, because that's going to make it tighter, and we really don't have probably that many people that are going to need the blue. Okay, so now do we have room to bring the Hoyer? Okay, we'll bring the Hoyer. Okay, this is the Hoyer. This is the controller for it. The controls move it up and down with the arrows, and then there's only 4 controls on it. The other 2 controls are for the legs, making the legs go wide or the legs come back narrow. So when you're transporting this around, it's best to have it narrow, just so that you're not running into things. When you have patients in it, they advise to always have it, if you can, always have it out wide. Why is that? Base of support is wider, right? Definition of balance is maintaining center of gravity over base of support. If you don't do that, then you fall. So this thing could tip over. So they suggest always having it wide. This thing also has brakes on it. These brakes, we were told, are for OSHA compliance. They have to be there. We were not to use them. The reason being, if the brake's on and the machine starts to tip, the base cannot roll underneath the patient. But they have to put them on there because the government wants them on there. If you use them, it's not safe. That's what we were told. Makes sense. Okay. So if you walk up to one of these machines, and I think there are 2 still in operation in the hospital, although I saw one down in maintenance to get fixed. If the buttons don't seem to work, it could be one of 2 reasons. First, maybe it wasn't plugged in and the battery's dead. And second is this red button here, if it gets pushed, which this is a weakness. It's for an emergency, but I'm not really sure what it does. I think it initiates a manual override so that if it goes dead, you can still lower it with a patient in it. But I can't remember how that works. But if you twist this, it pops out, and then it'll work again, as long as there's battery charge. Also, this has to be out in order to charge. So if you bump into it, it goes in. That's the problem, right? So if you hit it, it goes in, and plug it in, the machine won't charge. So, and to pop it out, you just twist it and it pops out. All right. Also, the Hoyer lift is always supposed to be used with 2 people. One person runs the Hoyer, one person has hands on the patient. All right? So, with the legs wide enough, you can, oh boy, I didn't think about that, did I? Let's go on the other side. On the other side. So we'll hook the patient up. So this has a pad on it. The pad is just enough to not mar somebody, but it's still going to hurt. So always when you're
It's not grievous, probably.
yeah, it's not. It's just a flesh wound. So you'll roll this up as close as you can get it. I'm hitting something over there, but now I can't walk around. Can you grab it or move it out of the way? There we go. All right.
We like our patients to help us.
Yeah. All right, so we're going to use the white strap or the white hook on it, and we're just going to hook them up like so. When we lift someone in these, or when we're hooking someone up, we generally ask them to kind of get their arms across this way. Oh, thank you.
Which way? This way?
Yep. But then once we get moving, then people generally want to, and that's fine, to put their hands up here. We just ask that they don't get them up here. I don't think they ever get pinched, but we just have people hang on up here. It helps them feel more secure. But again, they don't have to. They don't have to hold on. They just, people are always looking for something to do with their arms when they're suspended up in it. So does someone want to be my patient person who's over here, since I'm not supposed to use this without? Good. Thank you for
There we
volunteering.
go.
Thank you,
Right
April,
there.
for volunteering. I don't have time to wait for volunteers. We'll have volunteers. All right. So there is a handle on the back. Once he lifts up, there's a handle on the back, and that's where the person who's assisting with the patient is supposed to be. Also watching the patient's head to make sure they don't come forward. And actually, they're not really going to bump their head on the way up. When they'll hit their head is when you lay them down, and then you just, if you're running this and you're focusing on the machine, you're just going to keep going down, and this arm just gets closer and closer and closer to their head, which is fine. You need it to be down there in order to unhook them, but you've got to be watching it. So this person with the patient is to tell you if you're not paying enough attention to where that arm is and you're going to hit them. So, and that is very real. All right, so then we lift. And this is the other thing, when it comes up, when any patient comes up here, their feet will sometimes get caught. So you also want to be mindful of their feet, and that also, both people should be paying attention to that, but the one who's kind of in charge of the patient, feel that, how your feet are hooked on there.
Mm-hmm.
And then not only hooked on there, but then it comes into the machine. So once we get them up out of the chair, we'll generally move them, and then depends on where the bed is and the position, then we'll just bend their knee and like turn them so that we're more.
Can I just work like this?
So that we're more like this.
I'm totally okay
So here,
with that.
so you can see here, there's a handle in the back, and this is where this, like April would be if we were like doing transfer. She would be here, and I would be back here to actually move the machine around. So we could wheel him around the room. He's in no danger of falling. This can hold up to 600 pounds. So yeah, just that's when you're spinning them, is when you watch out for the knees over here. So it just depends. If you're going to come up to the side of the bed, then you want them to be
Send that one to him.
you want them to be sideways. If you like, you just have to practice with this machine. Some of the beds you can't go in sideways. So our plinths, we come in from the bottom of the plinth, and then when we get them up over the plinth where we want them, we'll bed. It's a bed that's skinnier and moves up and down. I don't.
Never heard me call it.
A cart? Okay, all right, it's a cart without wheels. Okay, so it's like a mobile home that doesn't go anywhere, all right? It's a cart, it's a wheelless cart.
You get it at IKEA?
I don't know. We get ours from Medline. So we would get them up as far as we could, and then we will pull them back this way to get them even higher. And notice that this machine, then it starts moving, right? Because it's trying to keep him in the center of, or in the basic support. So we'll just roll him back in here somehow. Make sure we're high enough. All right, so when we get up here, notice how he's kind of laying down. So when I start lowering him, then April will pull him back so that his hips are as far back in the wheelchair as possible, so that he's sitting appropriately. Don't tip the wheelchair over.
He's still listening.
Trusting you guys.
Okay, so you see how these are tight? So if this is one that maybe fit him a little bit better, I would be looking to make sure, okay, is this loose enough for us to get him out of here? And I'm not paying attention to where this is, and that's where we have to be like really diligent. And then also these will sometimes hit their shoulders, so anyway, or right in the face. So anyway, it is that simple. There's just a few of those high points to watch for. Everything else is pretty straightforward and easy. So yeah.
Good job.
Excellent.